Hi, everyone. Thank you so much for joining. My name is Kate. I'm going to be leading this webinar today. I'm just going to wait a few more moments to allow some final people to join the call. So just bear with me a few moments and we'll get started in about 2 minutes. Okay, the numbers have started to slow, so I'll get started. Hi, everyone. Thank you so much for joining today's webinar. Welcome. This is a webinar on better booking at your fingertips. My name is Kate, and I'm an implementation manager here at Accurux. And in today's session, I'm going to be focusing on the exciting new self-book features that are coming your way. A couple of things just to note before we get started. First of all, this webinar is being recorded and we will share the recording with everyone who registered in a follow-up after the session. So please don't worry if you have colleagues who were unable to join for any reason. We also have a Q&A running, so please do ask questions throughout. I'm joined by a few of our team who will be typing up responses to any of your questions throughout the webinar via the Q&A function. And we also have some dedicated time at the end for any additional questions if that's needed. So please do make use of the Q&A as we go along. So what can you expect from today's webinar? Well, Selfbook was originally built to remove the manual processes of booking patients into appointments, and it's about to get a whole lot better. So we wanted to share this with you. In this webinar, we're going to deep dive into the new Selfbook features and find out how you can simplify appointment bookings once and for all at your practice. You'll hear how to enhance patient choice and save yourself the hassle of manually booking patients into appointments. We're going to start by going over the basics, so discovering what Selfbook actually is and what you can do with it. We'll then be taking a look at the following new features. So we'll start with specifying a clinician, which is the ability to choose a clinician when composing a Selfbook invitation. We'll then take a look at booking across sites with cross-sort booking. So sending individual self-book invitations for a different site within your hub or PCN. We'll then move on to scheduling self-book invitations. So scheduling self-book invitations for further into the future. And then we'll have a look at developments in the NHS app. So this is further integrations that we have coming with both batch messaging and appointment reminders soon to be going via the NHS app. Plus, we'll introduce you to our brand new e-learning pack that will help you continue to get the most out of self-book beyond this webinar. This pack has been built to support your continued self-book discovery and will be shared with you in our follow-up after the session, along with the session's recording. Before we begin, I just want to point out that all of the functionality I'm about to cover is currently available to you. But as I'm sure you're aware, the NHSE contract is coming to an end in July, after which these services will need to be procured either at an ICB or PCN level. By now, you should have received confirmation from either ourselves or from your ICB to inform you of what access will look like moving forwards. However, if you are unsure about what your situation is moving forwards, then please do reach out to our partnerships team who can help ensure you've continued access. So you can get in touch with our partnerships team at partnerships@accurix.com, who will be happy to help and support any questions you may have about this. Their email address is also on the screen at the moment, and it's in a slide further on in this slideshow as well. So let's start at the beginning then. What actually is self-book and how can I use it? For busy primary care professionals under pressure to deliver more modern, enhanced patient access, self-book offers user-friendly, integrated tools that remove the manual processes involved with appointments, helping practices to easily reach their targets. By reducing inbound phone calls and automating manual processes, you can save valuable time on everyday tasks within your practice. Self-book is built ready-made to work with your appointment book, so you can start sending invitations with no additional prep required. And when sending a self-book link, practices can select any slot type from their appointment book as long as there are appointments available. So what can you actually do with self-book? First of all, we can invite an individual patient to self-book an appointment quickly when composing an SMS message. So this is supporting acute care and effectively managing inbound patient requests by quickly inviting an individual patient to book an appointment. When sending a text message to your patients, you have the option to add a booking link for the patient to book their own appointment. This can be found from within the Compose screen, so that's the message icon on your Accurix toolbar. With a patient open in your clinical system, you'll be able to send a message to your patient to invite them to book in for a telephone or face-to-face appointment at your practice. For telephone appointments, patients will be able to select from AM or PM window for their appointment, and for face-to-face, this will be at a specific time. When adding this booking link, users will then be asked to choose which slot type they would like the link to book the patient into. Once selected, a link will be auto-generated into the body of your message, so as you can see in the screenshot online, and this will be valid for 7 days. Appointments that patients can see are then scraped from your appointment book, so it's only the appointments that you do have available. These appointments are also embargoed as well, so when a patient books in, it will no longer appear as an option, and you don't have double up of patients booking into appointments. A specific use case for individual self-book could be for blood tests, for instance. So during a consultation, you may decide that a patient needs to come in for blood tests, and you can send them a booking link then and there for a blood test appointment, allowing the patient to then go home, book themselves in at their own convenience, as opposed to waiting at reception and having to call back in later. The second use you can see on screen is inviting a batch of patients. So inviting a batch of patients to self-book for a specific appointment type, such as a flu vaccination, monitoring bloods, cervical screenings, or chronic disease reviews. This supports the delivery of long-term condition management and preventative care with a quick, secure way to invite an unlimited number of patients to book an appointment. Batch self-book allows you to invite larger cohorts of patients to book in for a specific appointment type than for individual, as we've just discussed. So with batch self-book, you can set up you could set up your flu clinic, for instance, with the right kind of slot for your flu jabs, and then use your CSV file of relevant patients, upload that into batch self-book, and then invite them all with one message to your specific flu clinic, saving your practice huge amounts of time, huge amounts of back and forth, and the manual processes seen with current methods when not using self-book. This is also far more convenient for the patient, who can then choose a time that suits them at their leisure. Patients also have the option to not only be offered to book an appointment, but also allows them to decline the specific type of self-book appointment you have invited them to book into. This is also automatically SNOMED coded back to the record with a SNOMED code that you choose. For instance, for flu, it might be that the patient chooses to decline a particular vaccination. This helps the practice to record the patient's wishes, but also allows your practice to achieve QoF targets while also benefiting the patient at the same time, as they are not repeatedly asked the same question as to whether or not they want the flu vaccination. This will negate the need for them to phone the practice to let them know that they don't want the vaccination, and again will free up time for staff who can focus on patients that do want the appointment. Other use cases are things such as cervical screenings. So we know there are loads of barriers in the uptake of cervical screenings. By using booking, you can remove the barrier of having to call up, wait, and then negotiate a convenient time. Self-book allows patients to book in themselves at a convenient time and will surface all the appointments available for booking the smear. You can also use Accurate's message templates or create your own and include SNOMED codes that will save back to the record. The final use we have on the screen here is that effectively triaging patient inbound. So effectively triaging patients by sending a self-book link in response to online consultation requests via patient triage. You could also combine this with structured patient questionnaires to maximize patient support if you wanted to. So inviting a patient in response to a conversation within your inbox, supporting effective inbound demand management. When triaging patient inbound requests, you have the option to add a booking link to your response and invite a patient to book themselves in for either a telephone or face-to-face appointment. This supports modern general practice access. Using a combination, it can be used in combination with other Accurate tools. So as I mentioned, you could add in a patient questionnaire if you wanted to, and practices can offer simplified appointment bookings based on the clinical need. Users benefit from a seamless experience when triaging their patients, with one click to add a self-book link when needed. This can reduce the friction and time taken to triage patient requests, with both healthcare professionals and patients feeling relieved and happier. Patients over time will benefit from an improved experience when requesting care, whilst practices will save further time, finding it easier to achieve their GP contract aim of same-day assessment of needs. Not forgetting, on top of this, that self-book also integrates seamlessly with your EPR without the need for any further intervention from users. It allows for 6 weeks of appointments to be visible for patients and saves to the record with automatic SNOMED coding, as I've mentioned. So what are the benefits of self-book for practices? At Accurix, we're incredibly proud of our self-book functionality, as we believe it combats a lot of the major flaws in the current system and allows practices to save valuable time. Practices simply need to set up appointments in their clinical system and then invite patients to book into the appointments that suit them best, a process that would have previously required a patient to wait in a phone queue for hours. This reduces the time spent by patients and staff on the phone, leading to happier, more engaged patients, which in turn leads to better patient and staff interactions. This increased patient access also leads to a reduction in DNAs, as patients are more engaged in the booking process and therefore more likely to turn up to their appointments. Reducing telephone queues and freeing up phone lines. So rather than inviting patients to call the practice and having back and forth between, is this date suitable, is this time suitable with the patient, patients can book directly via the self-book link provided, resulting in less incoming phone calls and phone lines then being able to be freed up for more urgent calls. Self-book, as I've mentioned, also integrates seamlessly with your EPR. You can also save your messages sent containing the booking link to your patient's clinical record so that you have a log of that in your patient's record. It's easy to use and simple to book in an appointment. And also patients will have far more visibility, flexibility, and autonomy over booking their appointments. So as I've mentioned, this really helps to reduce those DNAs as they've had control over booking that appointment in themselves. In an independent evaluation of self-book in 2023, we found that 100% of practices said that self-book was critical to achieving QoF targets that year. 100% of staff interviewed said they would recommend self-book to other practices. Staff also reported that self-book had reduced stress, boosted morale, and improved job satisfaction. And 84% of patients found that self-book was easy to use. One quote from an administrator in Northwest London ICB previously stated that inviting patients to self-book an appointment has made my life a lot easier and stress-free. A case study from Alexander House Surgery in Frimley ICB has shown how they started using self-book to free up their phone lines, fill clinics, and save time and money. So Alexander House originally started using self-book for flu follow-ups. One feature they found really useful was the ability to stagger messages and to send them out of hours. They found that delaying these messages was really useful so they weren't clogging up their phone lines. They also loved the fact that with Batch, it can tell you how many available appointments you have. So you're not inviting a large cohort of patients to a small number of appointments, which really helps the practice to be reactive to the capacity that they have got, and then allows them to change their appointment book to match the needs of the patients within their practice. So since they started using Batch Self-Book and Self-Book as a whole, the practice has made six-figure savings over 3 years across the PCM. They have dramatically reduced call volumes and made the receptionist's lives far easier. They have delivered 4 times more health checks than before due to freed up clinical time. Self-Book has also improved the proactive care and long-term condition management at the practice. They're now inviting patients for cervical screenings, routine blood tests, NHS health checks, and vaccinations, and have seen an increase in uptakes from patients. Using Batch Self-Book, the practice was able to also hit QoF targets long before the end of the year. And patients have also expressed that they love the simple and effective way to book an appointment with more flexibility than ever before. A quote from Patrick Denston, the practice manager at Alexander House Surgery, states that Accurix is the most user-friendly piece of kit that we have. The time saved with sending out self-book links is incredible. The clinicians are really happy with it. Patients love it. Our patient participation group have all fed back positively, and it gives them the flexibility of looking at a selection of convenient times. They're not then sitting on the phone waiting to get through. So on to the exciting bit. What actually is new with Self-Book? Self-Book was built to remove the manual processes of booking patients into appointment, as I mentioned, and it's getting better. So we'll now take a look at the following new features. We'll start with specifying a clinician. So as I said at the beginning, this is the ability to choose a clinician when composing a Self-Book invitation. Book across sites with cross-all booking. So this is sending individual Self-Book invitations for a different site within your hub or PCN. And scheduling self-book invitations. So scheduling self-book invitations for further into the future. We'll also look at developments in the NHS app. So these are further integrations with both batch messaging and appointment reminders soon to be going via the app. Specify a clinician or choose clinician then. Over the next few weeks, you'll be able to specify a clinician when composing a self-book invitation, surfacing only these appointments to the patient, offering better team management and continuity of care with your appointments. The ability to specify a clinician in self-book has been a highly requested feature from our users and offers more flexibility and choice with self-book links. So we're super excited to be able to say that it's finally here and it's being gradually rolled out now. If a clinician isn't specified within this flow, then the patient will be able to book in with any session holder in your chosen slot. So what does this actually mean for your practice? Well, by specifying a clinician in self-book, you can improve team management, promote continuity of care, and also enhance patient choice. Self-book has been ready-made to work seamlessly with your existing appointment books. So once this has been rolled out to your practice, you'll be able to test drive this feature in 3 easy steps. With a test patient open in your clinical system, you can click on Compose SMS in your Accurix toolbar. You'll then want to select Add Self-Book Link as you usually would and choose your slot type. Then you'll see this new option, as you can see on the screen here, to specify a clinician. This will allow you to specify that clinician and add them in to your self-book link when you're adding the invite. I'm now going to take us over to a short demo so that we can see what this looks like in practice. So once this has been rolled out, when adding a self-book invite, a new option will appear, allowing you to specify as a clinician, as we can see on screen. You'll see frequently selected clinicians at the top of the drop-down, for instance here. You can also select more than one clinician if you wanted to add to that self-book invitation. You can use the search bar to then search for a specific clinician's name, add them in, and then add self-book invite. When composing the rest of your message then, you can clearly see which clinicians the patient can book with. So as you can see on the screen here, we've booked in one GP routine appointment face-to-face with these two clinicians. Clicking on send now, it really is as simple as that. Booking across sites then. Cross-organisational booking allows practices to send individual self-book invitations for a different site within their hub or PCN. This enables practices to share capacity in their local area and removes the admin that comes with booking by offering a simple way to book a patient into a different site. This will help to support hub and PCN-wide bookings for vaccinations and similar slot types. An additional drop-down will appear in the self-book flow, as you can see on screen, that will allow the user to select the practice and any slots they would like to send an invite for. Bookings do not need to be limited to within a PCN and can be between organisations within the same locality, but that are part of different PCNs. Again, this was a very highly requested feature by our users and customers and is currently being piloted. If you would like early access to this feature, then please do head to our Facebook community, as we will be communicating further information and sign-ups when we're ready to roll this out more widely. With this simple and easy to use booking software, you'll be able to reduce the administrative burden of booking patients into different sites. You'll also be able to share capacity with healthcare organisations in your area. And finally, enhance patient access with greater choice. Together First Federation is currently piloting our cross-org functionality, offering practices they work with the ability to use self-book to invite patients to their enhanced access appointments. Here's what Mohammed Abedin, Data and IT Support Officer, had to say about this feature. Cross-org booking has changed the game. As a federation, we offer enhanced access services across multiple practices, and this has really streamlined the way that practices can get their patients booked with us. As I mentioned, if you'd like early access, then please do join our Facebook community, where we will communicate about early access signups when we're ready to roll out further. You can use the QR code that's on the screen right now to access the page and stay in the loop with the Facebook community and also when we will be rolling this out. So how does Crossorg actually work? Well, practices will be able to send a booking link to a patient and then select a different organisation to their default for the patient to book themselves in at another location. Please note that it doesn't matter if these organisations use a different clinical system to the home practice. This functionality will still work. Users can then select a slot type that has been marked as GP Connect bookable by the other practice. If no appointments are available, this will be indicated. Users can then add their self-book link to their SMS message and view where the patient will be booking into. Once the patient then clicks on the link, they'll be able to clearly see that the appointment is being hosted at another site to their home practice. So if you take a look at the demo on screen, we can select an organisation from the drop-down. So as you can see here, we're selecting Wessex Road Practice. You'll then be able to choose a slot type and add the self-book link to your message. So we're going to select here, routine bloods, telephone appointment at Wessex Road Practice. We can then view where the patient will be booking in and send our message. So as you can see in the body of the message here, the patient's being booked in for a routine blood appointment via telephone with Wessex Road Practice. Moving on then to scheduling invitations. So at the moment, you can schedule self-book links for the next working morning. From next month, however, you'll be able to schedule invitations for further into the future. Scheduling booking links will be available in June. This will allow users to schedule individual self-book invites further into the future than the next following day, which will improve their abilities to plan ahead. With this functionality, practices have greater flexibility with self-book links, improve follow-up appointment planning, reduce task churn for users working outside of core hours. As you can see in the screenshot on screen, we will have the option, an additional option in the drop down to add a custom date and time to send these invitations out to patients. Currently, this just goes up to tomorrow at 8 a.m. Practice teams can then plan routine appointments ahead of time, ensuring patients will receive an invite at an appropriate time of day and even when staff are out of office. Scheduling features will help to reduce the need for staff to work out of hours, helping users to feel more in control of their appointment planning. And healthcare professionals are happier spending less time on manual administration tasks or starting work early in order to complete tasks. Accurix is a very proud partner of the NHS app. We share their vision of creating a digital front door to healthcare, and through our partnership, we aim to enhance patient access and save resources across the health and care system. From this summer, Accurix will be integrating batch self-book and appointment reminders within the NHS app, helping to further enhance patient access and reduce costs for primary care organisations. This will be integrated for all GP practices in England by the end of June. And these integrations will further enhance the app's functionality and help to reduce SMS costs. We're also coupling these releases with an update to our SMS fallback time, which provides patients with an extended window of 24 hours to action messages within the app before our software will initiate an SMS message. So batch self-book messages will be sent via Accurix will automatically deliver to the NHS app if a patient has the app downloaded and notifications switched on. Batch self-book links will now deliver to the NHS app, which will provide an additional secure and trusted route for patients to book appointments with their GP. There are no additional steps for healthcare professionals to take as integrations are automatic. So nothing is needed on your end once this is ready to go live. Practices will hopefully then feel safe in the knowledge that they are improving patient access in a secure way, whilst reducing the need for manual processes like letters and telephone calls. And finally, primary care providers can reduce SMS fragment costs and save valuable time by utilising additional patient contact routes. Patients should find that accessing care becomes more streamlined and equitable. So as I mentioned, this is due to launch in summer of this year. It's currently in development and there'll be more information on this in due course. Finally, we have a very exciting new tool that has been built to support your continued discovery of self-book. This comprehensive training module takes you through different elements of self-book in a structured and bite-sized way. It saves your progress and allows you to dip in and out of the course to see how it works for you. It includes case studies, benefits, FAQs, and all of the information regarding the new features I've introduced you to in today's session. As you can see from the short demo seen on screen, this first introduces users to a short overview of what Selfbook is, followed by tips on how to get started and what's next once you're comfortable with the basics. You can jump in and out of the module depending on where you are in your Selfbook journey, and it's a really useful tool regardless of prior knowledge with Selfbook. So this structured learning caters to your Selfbook needs. It's suitable for anyone in their Selfbook journey. And no matter the level of knowledge you have, there's something for you to learn. This module is going to be shared with you alongside the recording in our follow-up. Also, look out for further e-learning packs for other products and workflows as they come, as these are due to be rolled out in the coming months. You can scan the QR code on screen and you'll be able to have access to this straight away as well if you're eager to get started with it. Finally, please do join us at our next webinar at 12 p.m. on Wednesday, the 19th of June, where we will deep dive into all the different ways you can use Selfbook. We'll also be joined by our guest speaker, Dr. Adam Cliff, to hear about the ways he uses Selfbook in his practice. Again, don't worry if you can't make the session. If you register, we'll share a summary and the recording with you afterwards. Please do use the QR code on screen now, and you'll be able to sign up and register for that session on Wednesday, the 19th of June. We now have time for some additional questions if there are any that haven't yet been answered. So just bear with me a few moments while I go over. Apologies, I'm just reading through any questions that haven't yet been answered. Okay, so we have one question. If you have selected those two clinicians, but none are available, will it then go back to others that are available? The answer is no. If all appointments with those specified clinicians are taken by the time the patient goes to book an appointment, the patient will not be able to book in with anyone else and will be asked to try again later or contact the practice. I hope that answers your question for you. We have another question. Can you stagger batch self-book? Yes, you can stagger batch self-book. Yeah, within batch messaging, that you will be able to do that. Brilliant. Glad that answered your question. Few more coming in. Great to hear that, Patrick. Nice to see you on the call. Really happy. So Patrick, who did the case study, practice manager there, has said since the case study, we have also been able to hit 100% quaff before the end of the year. Really positive to hear. Thank you so much, Patrick, for sharing. Another question, what happens on the 1st of July 2024 if we don't pay for self-book? Does the option disappear from our Accurix tools? Does it remain in the list but is grayed out? Or does it remain and someone can select it, but then the message doesn't get sent? Thanks very much for your question. If access has stopped, then it will disappear. So no option to include a booking link when composing individual SMS or within batch messaging. Both of those will go. Just as a summary for the release dates for all of these upcoming launches, so I'll go over them. NHS app integrations of batch and self-book are launching by the end of June of this year. Cross-all booking is currently in pilot. Please do join our Facebook desktop community, which you can see on screen now, to keep an eye out for early access as we will be communicating about any changes and updates there with the rollout via the Facebook community. The ability to specify a clinician is ramping up rollout from next week, and all practices should get access to this within the next 2 weeks. And then scheduling self-book links will be available sometime in June. So all to come over this summer. If you would like to find out if your PCN or ICB is going to be paying for self-book moving forward, then you can either reach out to them or you can speak with our partnerships team. Their email address is linked on the screen right now. Another question, can you hide clinicians on self-book if you don't choose someone specifically? So if you don't choose someone, then that's absolutely fine. The patient will just have the option to book in with anyone at an appointment slot that suits them best. So there's no need to kind of hide. They would just be you either include a specific clinician or you wouldn't. There are still a fair few questions, but I think what we will do is just wrap this up. We'll kind of take some themes out of all of the questions that have come through and put this into a follow-up along with the recording and then also access to that e-learning pack that I've just shown you. Thank you all so much for joining. I hope this has been useful. We're really excited to share these developments with you. Yeah, so thank you so much. If you have any additional questions, then we will share everything in a follow-up, and please do get back to us either at customer success or via partnerships at accurix.com, or you can get in touch with our support team through our website as well. And please do join the Facebook community because there's heaps of information shared in there on a daily basis.